building subways quickly. Modern cities claim that building subway systems is impossibly expensive and time-consuming. New York's 2nd Avenue subway extension cost $2.5 billion per mile and took over a decade for just 2 miles. California's high-speed rail project has spent $10 billion and hasn't completed a single operational segment after 15 years. We're told that modern environmental reviews, safety standards, and construction complexity make rapid transit construction inherently slow and expensive. This is a lie. The same cities built extensive subway systems in a fraction of the time for a fraction of the cost decades ago. New York City built 31 miles of subway in just 4 years, between 1900 and 1904. The technology was primitive compared to today. They were using steam shovels and manual labor. Yet they excavated tunnels under a densely populated city, built stations, laid track, and opened the entire system in 4 years. The entire original IRT subway, the foundation of the New York subway system, was built in 4.5 years, from groundbreaking to opening day. This included 28 stations and complex underground infrastructure beneath Manhattan's streets. Modern extensions of a few miles take longer than the entire original system. Between 1904 and 1940, New York built over 300 miles of subway. The pace was extraordinary. Multiple lines constructed simultaneously. Complex transfer stations completed in years, not decades. Entire neighborhoods connected to the system rapidly. The city that built 300 miles in 36 years now takes 10 years to build 2 miles. London's underground expanded rapidly in the early 20th century. The Piccadilly line, 14 miles of deep-level tube tunnel, was built in 3 years from 1903 to 1906. Modern tunnel boring machines are far superior to the equipment available in 1903, yet contemporary projects move slower. Paris built most of its metro system between 1898 and 1930, over 100 miles of subway in 32 years, while fighting World War I in the middle of that period. Moscow built its initial metro system in the 1930s under Stalin, completing the first line in less than 2 years despite harsh conditions and limited equipment. What changed? Why could cities build rapidly with primitive technology but can't with modern equipment? The common excuse is environmental reviews and safety regulations. But the original subways were built through neighborhoods without displacing residents, under buildings without collapsing them, and with safety records comparable to modern projects. The engineering was sound. The real difference is political will and contracting structure. Early subway projects were public works built by governments committed to completion. Modern projects are public-private partnerships, with profit incentives for contractors to extend timelines and inflate costs. Delays make money. Change orders add revenue. There's no incentive to finish quickly. Additionally, early projects had streamlined approval processes. Once a subway line was authorized, construction began. Modern projects require decades of environmental studies, community reviews, and legal challenges before groundbreaking. By the time construction starts, costs have multiplied, and political support has weakened. The technology exists to build subways rapidly. Tunnel boring machines can excavate faster than the manual methods of 1900. Construction techniques are more advanced. Materials are better. Yet we're told that what was routine 100 years ago is now impossible. The truth, building subways quickly is not impossible. We choose not to do it because the current system profits from delays. Eradicating diseases. Modern medicine claims that eradicating diseases is an incredibly difficult, expensive, and time-consuming process, requiring decades of research and billions in funding. We're told that eliminating diseases like malaria, measles, or polio from certain regions is nearly impossible due to vaccine hesitancy, logistical challenges, and limited resources. This is false. We eradicated smallpox globally in less than 2 decades with 1960s technology and a fraction of today's medical budget. Smallpox killed millions annually until the 20th century. It was one of humanity's deadliest diseases, more lethal than plague, more persistent than cholera. The World Health Organization launched an eradication campaign in 1959, intensified it in 1967, and declared smallpox eradicated in 1980. 21 years from campaign launch to complete global eradication. Gone. The last naturally occurring case was in Somalia in 1977. A disease that had killed hundreds of millions throughout human history was eliminated from Earth in 2 decades. The eradication was accomplished with technology far inferior to what we have today. No genetic sequencing, no advanced vaccine development, no sophisticated cold chain logistics. The vaccine was manufactured using techniques from the 1790s, literally cowpox cultivation on calves, a method Edward Jenner would have recognized. The WHO campaign succeeded through aggressive vaccination drives in developing countries, case surveillance to find every infection, and ring vaccination around outbreaks. They went door to door in remote villages, crossed war zones to reach populations, and maintained vaccination programs despite civil conflicts and limited infrastructure. The total cost was approximately $300 million in 1970s dollars, roughly $2 billion in today's money. For comparison, the U.S. spends over $50 billion annually on cancer research alone. Smallpox eradication cost less than 1 year of modern cancer research funding and eliminated a disease entirely. After smallpox, we nearly eradicated polio using similar methods. Polio cases dropped from 350,000 annually in 1988 to just 33 cases globally in 2018. The disease was eliminated from entire continents using vaccines developed in the 1950s and 1960s. But now, polio is resurging. Cases increased in 2019 and 2020. Afghanistan and Pakistan still have endemic polio. The disease has reappeared in countries that had eliminated it. Why? Not because eradication is impossible. We proved it's possible by nearly achieving it. Because vaccination campaigns were defunded, political instability disrupted programs, and misinformation reduced vaccine acceptance. Measles shows the same pattern. The disease was declared eliminated from the United States in 2000. Then vaccination rates declined and measles returned. We solved measles, eliminated it completely from the country using a vaccine developed in 1963. Then we chose to stop maintaining the solution, and the disease came back. We're told that eradicating diseases is incredibly difficult, but we did it with smallpox using 1960s technology. We nearly did it with polio using 1950s vaccines. We did it with measles in the U.S. using basic public health measures. The problem was solved, then funding was cut, programs were abandoned, and diseases returned. The truth: disease eradication is not impossible. We've done it. We stopped doing it because we chose to defund the programs that worked. Building affordable housing. Modern developers and city planners claim that building affordable housing is economically impossible. Construction costs are too high. Land is too expensive. Regulations are too strict. Profit margins on affordable units are too low. We're told that housing everyone affordably can't be done without massive government subsidies or accepting lower quality housing. This is a lie. Cities built vast amounts of high-quality, affordable housing in the mid-20th century, often with smaller government subsidies than today. Between 1950 and 1970, the United States built millions of affordable housing units, not just basic shelter, quality homes in planned communities with parks, schools, and infrastructure. The homes were affordable for working-class families on single incomes. Teachers, factory workers, and clerks could buy houses. Levittown, the archetypal post-war suburb, sold homes for $7,790 in 1947, about $110,000 in today's dollars. These weren't tiny apartments. They were 750-plus square-foot houses with yards, sold to families earning median wages. A postal worker could afford a home. The construction method was straightforward: mass production techniques, standardized designs, efficient assembly. Levitt & Sons built 17,000 homes in Levittown, Pennsylvania in just 4 years. They were completing 30-plus houses per day at peak production. Modern developers claim comparable production is impossible. Public housing projects of the same era provided quality, affordable housing, not the deteriorated projects of later decades. Original public housing developments were well-designed, well-maintained, and successfully housed working families. Stuyvesant Town in New York, built 1945-1949, provided 11,250 apartments in 35 buildings. The development included parks, playgrounds, and green space. Rent was affordable for median-income families. The buildings still stand, well-maintained and desirable, proving the construction quality was high. Vienna, Austria, provides the clearest example. Between 1920 and 1934, Vienna built 65,000 units of public housing. Massive apartment complexes with courtyards, playgrounds, libraries, and clinics. These buildings housed a quarter of Vienna's population affordably. The Gemeindebau, municipal housing, still exists. The buildings remain in excellent condition 100 years later. They still provide affordable housing to Viennese residents. The program succeeded, the buildings lasted, and the city proved that affordable quality housing is completely achievable. Vienna continues building affordable housing today. Over 60% of Viennese residents live in subsidized or rent-controlled housing. The system works. The buildings are maintained. People are housed affordably. Vienna solved affordable housing and never stopped solving it. What changed elsewhere? Why could American cities build affordable housing in 1950, but claim it's impossible now? The construction technology is better today. Materials are superior. Techniques are more efficient. Yet housing costs have increased far beyond inflation, while quality has declined. A 750-square-foot Levittown house cost 2.5x median annual income in 1950. A comparable home costs 5x median income today. The difference isn't construction costs, it's land costs, zoning restrictions, and profit expectations. Land that housed affordable developments was rezoned for luxury housing. Zoning laws prevented dense, affordable housing construction. Developers focused on luxury units with higher margins rather than volume production of affordable homes. Additionally, housing construction shifted from integrated builder developers to fragmented systems with multiple contractors and layers of profit. Levitt and Sons controlled the entire process, allowing efficiency and cost control. Modern housing goes through developers, general contractors, subcontractors, and financiers, each taking profit. The technology and techniques to build affordable housing exist. We used inferior technology 70 years ago and succeeded. We're told it's impossible now with better tools because housing has been financialized. Homes became investment assets rather than shelter. And affordable housing doesn't generate sufficient returns for investors. The truth: building affordable housing is not impossible. We did it for decades. We stopped because housing as investment is more profitable than housing as shelter. Making college tuition free. Modern education policy claims that making college tuition free is economically impossible. State budgets can't afford it. Universities can't function without tuition revenue. The costs are too high. We're told that free higher education is an unrealistic fantasy that only works in small countries with high taxes. This is false. The United States had essentially free public higher education for decades, and it worked excellently. The University of California system was tuition-free until 1970. Students paid small fees for materials and services, but no tuition. California, not a small country, a state with more people than most nations, provided free university education to hundreds of thousands of students. The UC system during the tuition-free era produced Nobel Prize winners, pioneered research in multiple fields, and educated the workforce that built California's technology industry. Free tuition didn't reduce quality. The universities were world-class. What were the costs? In 1960, California's entire higher education budget was about 4% of state spending. This funded the UC system, the Cal State system, and community colleges. 4% of the state budget provided free higher education to all qualified California students. New York City University system was also tuition-free until 1976. CUNY provided free college education to New York City residents, educating hundreds of thousands of students from working-class and immigrant families. The free CUNY era produced extraordinary results. Students from poor neighborhoods accessed education that changed their lives. The graduation rate was high. The education quality was excellent. CUNY graduates became successful in every field. The ending of free tuition wasn't driven by unsustainable costs. It was a political choice during fiscal crises. California ended free tuition in 1970 under Governor Ronald Reagan, who believed students should pay for education. New York ended free CUNY in 1976 during the city's fiscal crisis. Once tuition was introduced, it increased steadily. What started as small fees became thousands, then tens of thousands of dollars. The UC system now charges over $14,000 per year for California residents. CUNY charges 7,000 pesos per year. But the universities didn't become 10 times better when they started charging 10 times more. The education quality didn't massively improve. The facilities aren't 10 times superior. What changed was the funding model. States reduced appropriations, forcing universities to replace state funding with tuition. Several countries still provide free university education today. Germany, Norway, Finland, Denmark, and others charge no tuition at public universities. These aren't small, poor countries. Germany is Europe's largest economy. They prove that free higher education works at scale. The argument that free college is impossible because costs are too high ignores that costs increased because tuition made them increase. When education is free, there's pressure to control costs because taxpayers fund it. When students pay tuition, there's incentive to increase amenities, expand administration, and raise prices because students borrow to pay. U.S. universities spent decades building luxury facilities, expanding administration, and increasing costs because tuition and loans made it possible. The average university has more administrators than faculty now. Facilities rival resorts. These costs weren't necessary when education was free. They appeared after tuition enabled them. The truth, free public higher education is not impossible. The U.S. provided it for decades. California and New York educated millions of students tuition-free. We stopped because states chose to defund universities and shift costs to students. Regulating working hours. Modern labor policy claims that regulating working hours and guaranteeing workers' time off is economically harmful. Requiring paid vacation would hurt businesses. Limiting work, weeks to 40 hours, damages productivity. Mandating overtime pay makes companies less competitive. We're told that European-style labor protections are impossible in the U.S. economy. This is false. The United States had stronger labor protections and shorter working hours in the past, and the economy functioned well, often better than today. In 1926, Ford Motor Company instituted the 40-hour, 5-day work week while paying workers $5 per day, twice the industry standard. Henry Ford wasn't being altruistic. He discovered that shorter hours with better pay increased productivity and reduced turnover. The results proved him right. Production increased, quality improved, worker satisfaction rose, absenteeism dropped. The company became more profitable, not less, by treating workers better. Ford demonstrated that shorter hours didn't harm business. They helped it. By 1940, the Fair Labor Standards Act established the 40-hour work week nationally, requiring overtime pay beyond 40 hours. This was federal law, not a suggestion. Employers had to pay time and a half for overtime. The mid-20th century American economy, often cited as the peak of American prosperity, operated under these strict labor regulations. The 1950s, 1960s boom happened with strong unions, regulated hours, and good wages. Prosperity didn't come from deregulation. It came during an era of strong labor protections. Workers in this era had evenings and weekends free. They took vacations. They had time with families. And the economy grew at rates higher than today's. The claim that worker protections harm economic growth is contradicted by the historical period of strongest growth coinciding with strongest worker protections. Other developed countries went further. France mandated paid vacation in 1936, 2 weeks per year guaranteed by law. The French economy didn't collapse. Productivity didn't plummet. Workers got vacation, and France remained prosperous. Today, European countries typically mandate 4 to 6 weeks paid vacation plus public holidays. Workers cannot waive this right. Employers must provide it. These countries remain economically competitive, with productivity per hour often exceeding U.S. levels. The U.S. stands virtually alone among developed countries in not mandating paid vacation. Workers get whatever vacation their employer chooses to provide, often starting at 0 for new employees and increasing to 2 weeks after years of service. We're told that mandating vacation like Europe would harm competitiveness, but we're comparing to countries that mandate vacation and remain competitive. Germany requires 24 days paid vacation plus 10 public holidays, 34 paid days off per year minimum. German workers are productive, German companies are globally competitive, and the German economy is Europe's largest. The working hours have also increased. While the 40-hour week remains the legal standard, actual working hours have crept upward. Salaried workers often work 50-60 hours without overtime pay. Email and phones extend working hours into evenings and weekends. The boundaries that once separated work from life have eroded. This isn't because modern work requires it. It's because labor protections have weakened. Overtime exemptions expanded. Enforcement of work hour regulations decreased. The culture shifted to glorify overwork as dedication rather than recognizing it as exploitation. The technology exists to work less, not more. Automation and computers should reduce necessary working hours. Instead, productivity gains went to employers while workers work longer hours for stagnant wages. The truth: regulating working hours and mandating vacation is not economically harmful. The U.S. did it during the most prosperous economic period in history. Europe does it now while remaining competitive. We're told it's impossible because employers prefer extracting more work for the same pay. Building high-speed rail. Modern transportation planning claims that building high-speed rail in the United States is impossibly expensive and logistically unfeasible. California's high-speed rail project is cited as proof. Decades in planning, billions over budget, nothing operational. We're told that America's geography, population density, and car culture make high-speed rail unworkable. This is false. Japan built the world's first high-speed rail system in the 1960s with far less sophisticated technology, and it worked perfectly. The Shinkansen, bullet train, began operation in 1964, connecting Tokyo and Osaka at speeds up to 130 km/h. The entire 320-mile line was built in less than 6 years, from groundbreaking to opening day. This was done with 1960s technology. No computers, no modern tunneling equipment, no advanced materials. The construction timeline is remarkable. Planning began in 1958, construction started in 1959, and trains began running in 1964. 6 years from decision to operation for over 300 miles of high-speed rail, requiring bridges, tunnels, and complete new track, the project cost 400 billion yen, about $3.6 billion in today's dollars. For comparison, California's high-speed rail project, connecting San Francisco and Los Angeles, has spent over $10 billion and hasn't completed a single operational segment after 15 years of construction. The Shinkansen succeeded immediately. Ridership exceeded projections. The trains ran on time with extraordinary safety records. No fatal accidents in 60 years of operation. The system expanded to cover most of Japan, now carrying 350+ million passengers annually. France built the TGV, high-speed train, network starting in 1981. The Paris-Lyon line, 260 miles, was built in 5 years and opened in 1981. The trains ran at 168 morph, cutting travel time from 4 hours to 2 hours. The system expanded to over 1,500 miles of high-speed rail across France. Spain built over 2,000 miles of high-speed rail between 1992 and 2020. China built over 25,000 miles of high-speed rail since 2008. The world's largest network constructed in just over a decade. These aren't small countries with easy geography. Japan is mountainous and earthquake-prone. France is comparable in size to Texas. Spain has difficult terrain. China is vast. All of them built extensive high-speed rail systems successfully. The technology required for high-speed rail exists and is proven. Trains running 200+ mph are routine in multiple countries. The engineering challenges have been solved. The systems are profitable or cost-neutral in most countries where they operate. What makes it impossible in the United States? Not technology, geography, or engineering. Those are excuses. The real barriers are political and structural. U.S. transportation funding prioritizes highways and aviation. Rail receives a fraction of the subsidies given to roads and airports. Interstate highways were built with 90% federal funding. Airports receive massive federal subsidies. Rail projects get minimal federal support and must cobble together funding from multiple sources. Additionally, freight rail companies own most rail corridors in the U.S., and they oppose passenger rail that would require sharing tracks. In other countries, rail infrastructure is publicly owned, allowing governments to build passenger systems. In the U.S., private companies control the infrastructure and resist change. The environmental review and approval process for American rail projects takes 10+ years before construction begins. Japan's Shinkansen went from planning to operation in 6 years total. California's project spent over a decade on approvals before breaking ground, then faced endless legal challenges from property owners and local governments. But these are political choices, not technical impossibilities. The U.S. could streamline approval processes. The government could take infrastructure by eminent domain, as it did for highways. Federal funding could prioritize rail, as it once prioritized highways. The truth: building high-speed rail is not impossible. Japan did it with 1960s technology. Multiple countries have done it since. The U.S. built 47,000 miles of interstate highway in 35 years, starting in 1956, proof that large infrastructure projects are achievable. We're told rail is impossible because political will favors highways and aviation. Eliminating lead poisoning. Modern public health claims that completely eliminating lead exposure is impossibly expensive and logistically challenging. We're told that removing lead from old paint and pipes would cost hundreds of billions. Full remediation is unrealistic. We should manage exposure rather than eliminate it completely. This is false. We essentially eliminated lead exposure from gasoline and paint in just 2 decades, dramatically reducing blood lead levels nationwide. The problem was solved, then partially abandoned. In the 1970s, lead was everywhere. Leaded gasoline put lead into the air every time a car drove by. Lead paint covered walls in millions of homes. Lead solder joined pipes carrying drinking water. Children's blood lead levels were dangerously high across the country. The dangers were well documented. Lead causes brain damage, learning disabilities, behavioral problems, and reduced IQ. Even low levels harm development. Children were being poisoned systematically through their environment. The solution was straightforward: remove lead from products. The Clean Air Act of 1970 began phasing out leaded gasoline. The phase-out was completed by 1986. Lead paint was banned for residential use in 1978. These regulations eliminated the primary sources of lead exposure. The results were dramatic. Average blood lead levels in American children dropped by over 80% between 1976 and 1991. This is one of the greatest public health achievements in history. An 80% reduction in childhood lead poisoning in 15 years. The elimination of leaded gasoline alone removed 90% of lead from the air. Children stopped inhaling lead from car exhaust. Blood lead levels plummeted. IQ scores increased. Crime rates eventually dropped. Research links childhood lead exposure to increased crime rates 20 years later. The cost was minimal compared to the benefits. Removing lead from gasoline required reformulating fuel and adjusting engines. Changes the auto industry claimed were impossible and would ruin cars. The cars ran fine. The costs were absorbed easily. The benefits were enormous, but we stopped at partial solutions. Lead paint remains in millions of older homes. Lead pipes still carry water in many cities. The Flint, Michigan water crisis showed that lead exposure continues in communities that can't afford remediation. Removing all lead paint and replacing all lead pipes would cost an estimated $50–100 billion. This sounds expensive until you consider that lead poisoning costs the U.S. economy over $50 billion annually in healthcare, special education, and lost productivity. Full remediation would pay for itself in 1 to 2 years. But we're told complete lead elimination is impossible due to cost. The same country that spent trillions on wars and bank bailouts claims $50 billion to eliminate childhood brain damage is unaffordable. The technology exists. Lead paint can be removed safely. Lead pipes can be replaced. We know how to do it. We've done it millions of times in buildings and homes that could afford it. It's not technically impossible, just not funded. Several cities have begun programs to eliminate lead pipes. Newark replaced its lead service lines in under 3 years, ahead of schedule and under budget. Other cities claim the same project would take decades. The difference is political commitment, not technical capability. The truth, eliminating lead poisoning is not impossible. We reduced it by 80% in 15 years with 1970s, 1980s regulations. Complete elimination requires funding and political will, not new technology. We're told it's impossible because spending money to prevent childhood brain damage isn't prioritized. Providing universal health care. Modern American healthcare policy claims that universal health care is economically impossible. The costs would be unsustainable. Government-run healthcare would be inefficient. We're told that providing healthcare to all citizens is an unrealistic goal that only works in smaller, more homogeneous countries. This is false. The United States nearly achieved universal healthcare in the 1940s, and every other developed country has done it since, many with better health outcomes at half the cost. In 1945, President Truman proposed a national health insurance program that would provide health care to all Americans. The plan was comprehensive: hospital care, doctor visits, medications, all covered through a national insurance system funded by payroll taxes. The plan was politically viable. Post-war America was ready for major social programs. The infrastructure to implement it existed. The government had just mobilized the entire economy for war, proving it could manage complex systems. The plan was killed by lobbying from the American Medical Association, which spent millions convincing Americans that national health insurance was socialized medicine and would destroy healthcare quality. The campaign succeeded, and Truman's plan died in Congress. But consider what was lost. If implemented in 1945, the U.S. would have had universal health care for 80 years. Millions of people would have been saved from bankruptcy, denial of care, and preventable deaths. The system would be established and functioning like Social Security. Instead, the U.S. is now the only developed country without universal health care. Every other wealthy nation, Canada, UK, France, Germany, Japan, Australia, and dozens more, provides health care to all citizens. They prove it's not only possible, but successful. These countries spend far less per capita on health care than the U.S. The UK spends about $5,000 per person. France spends $6,000. The U.S. spends over $12,000. Americans pay twice as much for health care that covers fewer people and produces worse outcomes. Life expectancy is higher in countries with universal health care. Infant mortality is lower. Disease outcomes are better. And no one goes bankrupt from medical bills because health care is a right, not a commodity. The claim that government-run health care is inefficient is contradicted by Medicare, the U.S. government program for seniors that operates more efficiently than private insurance. Medicare administrative costs are 2–3% compared to 12–18% for private insurance. The government program is more efficient, not less. The claim that universal health care would be too expensive is contradicted by the fact that the U.S. already spends more per capita than any country with universal coverage. We're paying for universal health care prices while getting partial coverage. Switching to universal coverage would reduce costs, not increase them. Several studies have calculated the costs of single-payer health care in the U.S. Even conservative estimates show it would cost less than the current system while covering everyone. The money is already being spent. It's just being spent inefficiently through a fragmented private system. The technology and infrastructure to implement universal health care exist. The U.S. manages Medicare for 65+ million people. Expanding it to cover everyone is logistically straightforward. Other countries have done it with less sophisticated administrative systems. The truth, universal health care, is not impossible. The U.S. almost implemented it in 1945. Every other developed country has done it. We're told it's impossible because the healthcare industry profits from the current system and funds political opposition to change. Cleaning rivers and lakes. Modern environmental policy claims that fully cleaning polluted rivers and lakes is prohibitively expensive and technically challenging. We're told that industrial pollution has caused irreversible damage. Complete restoration is unrealistic. The best we can do is manage pollution levels. This is false. The United States cleaned severely polluted rivers and lakes in the 1970s, 1980s, transforming them from toxic waste dumps to clean waterways supporting fish and recreation. The Cuyahoga River in Cleveland was so polluted it caught fire multiple times. The river was an open sewer carrying industrial waste, oil, and chemicals. In 1969, the river literally burned, with flames rising 5 stories high. The fire made national news and became a symbol of environmental degradation. The Clean Water Act of 1972 addressed this. The law required industries to stop dumping untreated waste into waterways. Municipalities had to build sewage treatment plants. Polluters faced penalties for violations. The regulations were strict and enforced. Within 10 years, the Cuyahoga was dramatically cleaner. Fish returned, the fires stopped. By the 1990s, the river supported recreation and wildlife. The transformation from burning toxic waste dump to clean river took less than 20 years. The same pattern occurred nationwide. Lake Erie was declared dead in the 1960s, so polluted that algae blooms choked out oxygen and killed fish. Beaches closed due to contamination. The lake was written off as too damaged to recover. The Clean Water Act changed this. Phosphorus pollution was reduced. Industrial dumping stopped. Sewage treatment improved. Within a decade, Lake Erie recovered. Fish populations rebounded, water quality improved dramatically. The lake went from dead to supporting a fishing industry worth hundreds of millions annually. The Hudson River in New York was toxic with PCB contamination from General Electric plants. The river was too polluted for swimming or fishing. GE was dumping chemicals directly into the water for decades. The EPA eventually forced GE to clean up the contamination. The cleanup took years and cost billions, but it worked. PCB levels dropped. Fish became safe to eat in most areas. The river recovered from what was considered irreversible contamination. These recoveries weren't easy, but they were achieved with 1970s, 1980s technology. Modern remediation techniques are far superior. If we could clean rivers and lakes that were literally on fire with primitive technology, we can certainly clean today's polluted waterways with advanced methods. But we've stopped enforcing the regulations that made the cleanup possible. The Clean Water Act is still law, but enforcement has weakened. Industries lobby for exemptions. Violations are settled with small fines rather than forced remediation. Polluters have learned they can violate regulations and pay penalties smaller than cleanup costs. Recent contamination incidents show the pattern. The Flint River was poisoned by the decision to use it for drinking water without proper treatment. The pollution wasn't mysterious or unavoidable. It was a choice to save money that poisoned a city. The river could be cleaned with modern technology, but there's no political will to force it. Agricultural runoff now causes algae blooms in Lake Erie again, nearly 50 years after the lake was cleaned. The pollution is from fertilizer and manure washing into the water, a solvable problem with proper agricultural practices and runoff management. But regulation of agricultural pollution is weak, so it continues. The truth: cleaning severely polluted waterways is not impossible. The U.S. did it in the 1970s, 1980s with inferior technology. Rivers that caught fire became clean. Dead lakes recovered. We're told it's impossible now because enforcing pollution regulations conflicts with industrial profits. Reducing work commutes. Modern urban planning claims that reducing work commutes requires decades of infrastructure investment and cannot be achieved quickly. We're told that people must accept long commutes because of housing costs, job locations, and infrastructure limitations. Reducing average commute times significantly is presented as a long-term goal requiring massive investment. This is false. During COVID-19, average commute times were reduced to 0 for millions of workers in a matter of weeks. proving that remote work was always possible but not implemented. Before 2020, employers insisted that remote work was impossible for most jobs. Productivity would suffer, collaboration would fail, company culture would deteriorate. Employees needed to be in offices to work effectively. These arguments were accepted as fact. Then COVID-19 forced companies to allow remote work almost overnight. Within weeks, millions of workers transitioned to working from home. The technology existed. It had existed for years. What changed was not capability, but necessity. The results contradicted every claim about remote work being impossible. Productivity didn't collapse. Many companies reported productivity increases. Collaboration happened through video calls and messaging. Projects continued. Work got done. Companies that had insisted employees must be in offices 5 days a week suddenly proved that remote work was completely viable. The technology had existed the entire time. The jobs could be done remotely all along. Employers had simply chosen not to allow it. This wasn't new technology enabling remote work. Video conferencing, file sharing, and remote access existed for decades. Companies had the tools to offer remote work since the 1990s. They chose not to, claiming it was impossible or impractical. After proving remote work succeeded, many companies still forced workers back to offices, insisting that in-person work was essential. But the pandemic had already demonstrated this was false. The same work that was done remotely for 2 years was suddenly impossible to do remotely again. The claims made no sense. The commute time problem could have been solved decades ago by allowing remote work for jobs that don't require physical presence. Instead, millions of people spend hours daily commuting to offices where they sit at computers doing work they could do from home. Some jobs truly require physical presence: construction, healthcare, retail, manufacturing. But huge portions of office work can be done remotely. The technology existed. The capability existed. What didn't exist was willingness by employers to allow it. The environmental benefits of eliminating commutes are enormous. Millions of cars off the road, reduced traffic congestion, lower carbon emissions, less infrastructure wear. These benefits were achieved immediately during COVID lockdowns, proving they are achievable. The quality of life benefits for workers are substantial. Hours of commute time return to workers for sleep, family, exercise, or leisure. Reduce stress from traffic, lower transportation costs, better work-life balance. These benefits were experienced by millions during remote work periods. The claim that reducing commutes requires massive infrastructure investment is backwards. Reducing commutes requires no infrastructure. It requires allowing people to work remotely when their jobs permit it. The infrastructure needed, internet, computers, already exists in most homes. But employers prefer in-person work for reasons unrelated to productivity. Real estate investments in office buildings. Preference for direct oversight of workers. Company culture built on office presence. These are employer preferences, not technological or economic necessities. The truth: reducing work commutes doesn't require new infrastructure or decades of planning. It requires allowing remote work for jobs that can be done remotely. COVID proved this was always possible. We're told it's impossible because employers prefer office presence, not because the technology or capability is lacking. 10 problems we're told are impossible that were already solved decades ago. Building subways quickly. New York built 300 miles in 36 years. Eradicating diseases. Smallpox eliminated globally with 1960s technology. Building affordable housing. Millions built in the 1950s-60s. Free college, California and New York provided it for decades. Regulating work hours, the 40-hour week during America's most prosperous era. High-speed rail, Japan's Shinkansen, built in 6 years. Eliminating lead poisoning, reduced 80% in 15 years. Universal health care, every developed country has it. Cleaning rivers, polluted waterways cleaned in 20 years. Reducing commutes. COVID proved remote work always worked. These aren't theories. These are documented achievements. The subways still run. Smallpox is gone. The houses still stand. The rivers are clean. Solutions were abandoned because industries profit from unsolved problems. Subway delays make money for contractors. Defunded disease programs let pharmaceuticals sell treatments. Housing as investment beats affordable housing profits. Defunded universities shifted costs to students. Weakened labor laws benefit employers. Highway lobbies blocked rail. Partial lead cleanup avoided costs. Healthcare industry killed universal coverage. Water regulation enforcement declined. Employers blocked remote work for control. Every solution worked. Then those profiting from problems convinced people solving them is impossible. This propaganda is more effective than denying problems. It accepts them while preventing action. Housing is unaffordable, but solutions are impossible. Each claim contradicts proof that solutions work. The technology exists. It's superior to what solved these problems before. What's missing is political will. Solving problems requires choosing public benefit over private profit. 10 problems solved decades ago, we're told, are impossible. 10 pieces of evidence that impossible means we choose not to. These problems aren't impossible. They're unsolved by choice.